Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The Preventable. Before we get started with our guest today, I want to give a big shout out and thanks to Hubbard Radio for allowing us to record our podcast in their studios and share their space with them. It really makes it much easier to be able to engage in these conversations. I'm excited today to have a guest with me that is a new friend of mine. We recently met just earlier this year and hear about all the great work she's been doing in her life and her journey and in the St. Louis area. So welcome, Maggie Sullivan.
Thank you so much, Jenny. I'm really grateful to be here.
Excellent. So we connected, what was that? Maybe 5-6 months ago at this point now? If even that
Probably
long?
even a year ago.
A year ago?
Yeah.
Okay. See, time flies way too fast, doesn't it? But, we hear all the time around substance use work and the work that we're doing in this space of anytime there's any survey or focus group or community listening session or data that comes out, the biggest barriers are always housing and transportation, right? Mm-hmm. Like, hands down, it's almost become just expected. Like, I'm like, okay, don't tell me about housing and transportation. Tell me about other things that are getting in the way when we're trying to figure out, any gaps in services or anything like that. But they come up because they're real concerns.
Absolutely. And I'm the executive director at Gratitude House. It's a sober living home for women. And we do other educational programming and outreach besides providing sober living. And so we are a solution to that piece in terms of providing housing, even though we're more than just a house.
Right.
We're more than just a place to stay. We have an entire program that our residents are aware of when they apply. And we screen our applicants to ensure that our program is really what they want and really what they're ready for, what they're up for. Transportation is probably our biggest challenge if a resident doesn't have her own car.
Right.
That being said, we have a phenomenal board, we have phenomenal volunteers, and we have a list of people with long-term recovery who have put their phone numbers on a list so that anybody who needs a ride, or maybe they don't need a ride in terms of having a vehicle, but they just want to ride, be with somebody and connect with somebody, because connection is such a key component to recovery. So we've got phenomenal volunteers who provide rides for our residents who don't have cars, but even for those who do have cars and just want to connect.
That's fantastic. And that's really where we first connected was, learning more about the Gratitude House and wanting to hear more about it and knowing that when people are connecting to Prevent+Ed and looking for different types of services, we want to make sure that we have the resources for people and we know, kind of what we're telling people about and where to go. So I had the opportunity with a couple of my staff to come and tour the Gratitude House, and it is more than a house, but as a house, it is a beautiful house.
Beautiful. Gratitude House is not what you think of when you think of sober living. Our founders were very intentional. Our board, my staff were very intentional about elevating the aftercare experience and really providing a culture within the home that is conducive to somebody, not just staying sober, but really rebuilding their lives spiritually, financially, mentally, socially, physically. Our saying is, if you're willing to go to any lengths to stay sober, we're willing to go to any lengths to help you get whatever it is you need. And we've had remarkable success.
I love that because we know that everyone's path is different.
Everybody is different.
And so being able to, I think it's almost become, cliche to say, but it's just so true, like meeting people where they're at.
Yes. And I find working in the recovery industry, if you want to call it that, I don't like referring to it as an industry, but everybody thinks they have or wants to find the magic bullet. And the reality is we're dealing with a disease, and there are a lot of contributing factors that make everybody's cases everybody's case different. And at the same time, there are also some universals. So at Gratitude House, our programming might not be for everybody. So thank goodness there is programming of different types.
Absolutely. And that's it, that everyone's path is going to look a little different. Everyone's needs are going to be a little different. And
absolutely.
It's not a one-size-fits-all solution, because if it were just that easy, I say that often too, like if it were just that easy, it'd be that easy. And we're talking about human beings.
Right. And I think, just as the disease is progressive, where somebody is when they first use a drug versus they've been using it for decades, as well as where somebody is when they don't know anything about recovery, they're in recovery for the first time. Maybe they get it. Most people don't at first, so relapse is common. So, where you pick people up in the process of whether it's their addiction or recovery really should play a big part in how you personalize what it is that they need. Mm-hmm. And yet, I always come back to there are also some universals that we know to be true.
Yeah. So what, you don't have to go through the whole list, but what do you think are some of those top universals?
Connection and honesty.
Yeah.
I think when someone can be rigorously honest to just admit that the drug or the process, if they have a process of addiction, an addiction to a person, a relationship, when they can really, and I take that back, not rigorously honest, even if they just have the teeny tiniest glimpse of honesty that's a problem in their life, there's hope there. That's where recovery can begin. I also think that by nature, our disease, as well as the disease of codependency, makes us think that we're alone, causes us to isolate, brings on a lot of shame. A hallmark, too, of addiction and codependency is being a victim. Mm-hmm. And we're special, and, we're not responsible for what's happening to us. And so connecting with other people, I know people do recover without connection. I haven't met them, but I know I suppose it happens. And yet, the more, we know this even in education, the more social connections, the more personal relationships a child has, the more likely they're going to do better in school.
Right. One of the strongest protective factors is having those relationships with caring adults and when they're a young child, but those healthy relationships with peers and other people as you develop. Absolutely.
And that's true for adults, and it's certainly true for people affected by the disease.
Mm-hmm. That's great. So Gratitude House, how long have you been connected to Gratitude House? Tell us a little bit about the history of Gratitude House.
Well, interestingly enough, I just learned more about the history of Gratitude House this week that I can share. But I knew some of the original women who got together in about 2019 who said, we're not happy with what exists. We have our board chair has a daughter, and she's been very open with this. I know she'd let me share that her daughter struggled with addiction and was going to treatments and kept relapsing afterwards, which is very common, until a treatment center in Minnesota said she really needs to go straight to sober living. And because 60% of those who leave inpatient treatment will relapse within 30 days, it's often because they return to the very environment that has all the triggers that they were in before they left, even if those are loving and supportive environments.
Right.
And oftentimes they're not. So our board chair researched all of the possibilities for her daughter and said, none of this is acceptable to me. And so her daughter ended up going to sober living out in St. Louis. And her idea was that she didn't want any other family to not have what they need or be in her position. So she had family members in recovery, and her family members in recovery also had friends in recovery. So they put their heads together and began fundraising through the pandemic, which slowed everything down, and raised enough money to buy the house that we bought New Year's Eve of 2023. But alongside just buying a house, there really was a vision for something different that didn't already exist, at least in this region, and that was affordable. And so part of their vision was that, most sober livings tend to be in apartment style places or more institutional kind of living and not so great parts of the city or in areas where, your crack dealers standing outside preying upon the people going to sober living.
Some of that same environment that people might be trying to leave.
So the founders of Gratitude House wanted more than just a home. They did not just want a bed, a rent check, and a drug test. They wanted some place where women lived in an environment that reflected their self-worth. We know that what our environments look like plays a part in our self-confidence. It plays a part in our sense of responsibility. And so they envisioned a beautiful home that was beautifully decorated and furnished. And you've seen the home, you know that it is. And our philosophy is very different than a lot of sober living homes that have the philosophy their addicts are going to steal from us anyway, so you give them the bare minimum, you bolt down the furniture, and they tend to be kind of sterile, more institutional looking. And in no way do I want to minimize those places because they help a lot of people, but that was just not our vision. The other aspect is that a lot of sober living homes, if there's somebody in charge, it can be the resident with the most sobriety. Well, that resident, and perhaps she's getting, $10 or $20 off her rent. Well, for that resident who's probably new to sobriety herself, or generally new, and so these are her peers she's trying to hold accountable while she's got a full-time job or other responsibilities, that can be hard on the person you ask to be the house manager, quite frankly.
And set them up for some vulnerability, too.
Yeah, and drama. It's hard to hold your peers accountable. Now, for us, our house manager is paid staff, and she has 15 years of sobriety herself, and she has professional experience in social work and case management. Mm-hmm. So she's not a peer. She's very much a mother. She's very much a house mother. But her job is to hold them accountable. And
she can do that, it sounds like, with some more skills than just like a check-in.
Correct.
It's accountability, but then also that support there.
Correct. And she's got long-term recovery herself. Mm-hmm. So it's not just her, she's not trying to be friends with them. These are not her peers that they're getting sober together. That being said, they love her and really will do anything that she asks. And she's very loving, but she's also no nonsense. Mm-hmm. And it's hard to do that with a peer. The other part of our vision is that we are very structured because we believe that when you're new to sobriety, structure and routine are critical. And addicts are used to chaos. They're used to being up at night. Their sleep is interrupted. They're used to, kind of drama and trauma. And so it's a skill set to learn how to be on a schedule, to go to bed at the same time every night, to wake up at the same time every morning. And we require our residents to be steeped in recovery. They have to attend a 12-step meeting every single day. They have to have a sponsor and work those steps. We hold them accountable every single day for those things. We also make them do the fun activities in 12-step programs. We make them do 10 hours of community service. It's often very fun. And all of that, every rule, every aspect of our programming is rooted in what we know by experience, because a lot of us are in recovery, keeps you sober, but it's also rooted in the scholarship and the brain science and the most recent expertise that we have.
Yeah. And again, I think that that's incredible to take, a model that is something that can provide those basic needs for people, that support for people, that and really just put it into place. And like you said, it's not going to work for everybody, but for the ones that need that type of environment, it's available for them.
Yes, and a lot of times people new in recovery crave the structure and accountability, and they don't know how to get it. And so we have this in place. And I don't want it to sound like a militant boot camp, because it's not. People are free to come and go. There's a ton of love and laughter, and accountability is loving.
Yes.
And that's what newly recovered addicts want to feel is love.
Is love. And
I have to apologize. I should be using the term substance use disorder, people with substance use disorder, and I have to retrain my brain, because that's just newer language. So that's a me problem, not.
Well, and I often say, there's preferred language and person first language, and then there's talking about your own real life experiences and your own perception, and we're not the language police. That's for sure. Right. That's for sure. So it's
like when a store gets a new name, you've got to learn how to use the new name.
Absolutely. So you've talked a little bit about your own, life experience and that connection to it, but also really fascinating is that other science piece of it. And I think that's what I really have appreciated talking with you before about too, is, you do bring that perspective of, your own experiences, but also you have a doctorate in learning psychology and understanding development of substance use disorders and how people learn how to recover. Tell us more about that. How did that happen for you in life?
Well, so I'm an educator by trade, and just to clarify, my doctorate is not in addiction. It's not actually related to anything about addiction. It is in learning psychology and leadership theory. And like I said, I'm an educator by trade, and it just so happened that I myself got into recovery at the same time I started my teaching career, almost 30 years ago. And what struck me as a new teacher is when I would go to 12-step meetings, I was aware that there was learning taking place. And I really wanted to figure out how to capture the learning that was taking place in 12-step programs and translate that into my high school history classroom. Well, it wasn't that I wanted my high school history students to learn necessarily about addiction. My job was to teach history. But I was seeing real learning take place in 12-step. And if you're a good teacher, you want real learning to occur for your students. So, I just had these parallel personal and professional lives where I loved studying learning theory. And I was in the field, teaching high school students and for half my career. And then last part of my career was as a high school administrator, a principal and a president of high schools. I also taught some college. And it always fascinated me that, there was what I was teaching, history, but then there was how people learned. And an important piece of that was you had to have a relationship with your student. It didn't matter how well you knew your subject. If you didn't have a relationship with your student, especially at the adolescent level, even the college level, they weren't likely to believe you, engage, trust you, and really lean in and take intellectual risks, which is what is necessary for learning, right?
To be able to open your mind to
Correct.
These new ideas, yeah.
Correct.
But that's trust, too.
Trust,
that's that relationship, and that goes back to that trust piece.
And so, but what I saw in, my personal life, being steeped in 12-step meetings, was people were taking emotional risks to learn how to improve their life. And the topic just happened to be addiction, right? And you're more likely to learn from a sponsor, to learn from a group, to learn from a counselor when you have that trust. And so I got my doctorate it's a lengthy, wordy, niche doctorate in leadership and learning in organizations is the title, but my concentration was in learning psychology and how people learn in groups. It's a really deep dive into kind of social psychology and how do we learn in groups? How do we learn from each other? What are the best ways to manage groups and individuals so that they are learning from each other? And we see that in 12-step recovery all the time.
Yeah.
And so, I studied, how do people encode and then store, retrieve, and process information, whether it's history, math, or it's how to rebuild their life, how to rewire their brain. And I love, it feels like in the last 5 years or so, the scientific community has just brought on so much good research on addiction in the brain.
Yes.
And it really mirrors everything I was studying as an educator. So I used both my professional and academic personal background to cultivate the programming at Gratitude House and structure, 4 hours a week. They are in sessions where they're learning something. And so I use all of that to create kind of a curriculum. They don't realize I have a scope and sequence for this curriculum that they're learning, but I do.
Well, that's what it is. Well, and that's what it should be. I mean, I think that's what even, in the 18 years that I've been in this field working in substance use, I mean, part of it is, and the part of the reason that we're still working to reduce stigma and we're still having all these conversations is because for a long time, and it's not all the way there yet, it might be getting better, but we've been fighting people's misinformation or misperception about what is substance use. And until we've had more of that science to really back it up and help people understand, have those tools to explain to the general community, there's still a lot of other ideas around it.
Absolutely. And what it comes down to is trust. And the very thing that those affected by substance use disorder lack is trust, because the disease is rooted in lies, manipulation, broken hearts, broken trust. And so trying to get people to recover from the lack of trust, from the lying and the manipulation, whether that's the family affected by the person with the disease as well as the person with the disease, that's a big mountain to climb. And yet trust, I would say, can often be the foundation of rebuilding your life. Spiritual trust as well as interpersonal trust. And then for the public, the public can get sick and tired of the consequences or the amount of money spent or the misinformation that's out there.
Yeah, absolutely. Absolutely. And it's about that trust and that being able to work through this. And I think it's just really amazing that there's so many people who are in different pockets of this space, but all really saying a lot of these same things that are bringing together that art and that science.
Well, and I love that you bring up art and science because I can bring a lot of my academic background rooted in learning psychology to what I'm doing. And at the end of the day, the art is, loving people and connecting with people and being able to say, yeah, I've done that too, and I relate to your pain.
Yeah, I would imagine that in the first, days of someone's stay at Gratitude House, you're sitting down having a cup of coffee and talking with them and not telling them about brain science.
Not one bit. Yeah, right. And
I mean, those conversations come and they need to.
But you're exactly right. When somebody comes to you and they can't look you in the eye and they're nervous and shaking a little bit from the nerves and they're always in awe of the house, and a lot of them will say, I never imagined I'd be in a sober living place like this or a place like this, period. And yet they also bring, the vulnerability, the fear, the shame of, when you're new in recovery. So no, you're not talking about Vygotsky or, perception, memory, judgment while they're brand new.
Yeah. It's because you have to start with that trust and love and connection.
Right.
So if somebody was looking for more information on the Gratitude House or how to connect with you, what's the best way to do that?
Yep. So our website, if you just Google Gratitude House St. Louis, we should be the first and probably the only thing that comes up. but our website is gratitudehousestl.org, and it's got our email and phone number on there. And that's the best way to get in touch with us. Our website, I think, is really informational in that it lays out our philosophy, it lays out our house rules, it lays out the requirements, what the application process is like. We're building the educational programming that we would like to also provide the community. So you'll see a tab on there that says education and nothing's on the page.
Coming soon. Under construction, right?
But we also do just general outreach. I get a lot of calls where somebody says, my daughter, my son, my niece, my neighbor's struggling. What do I do? And I will, offer resources, whether or not they need sober living or not. I have driven people to treatment. I have met people for coffee. We offer free presentations on addiction and recovery that we've brought to school teams, counseling teams, even businesses who want to know more about how addiction affects the workplace. We've even done it for a large family who is considering an intervention. And we do that for free, and that's just part of our outreach, because not only do we provide sober living for women, but we really feel that we have a responsibility to do what we can for those that male or female need sober living or not.
That's amazing. That's really great. So if you're interested in learning more about the services at Gratitude House, or how to connect, or how to support, make sure and visit their website and get connected with Maggie. Thank you so much for being here today and enjoying this conversation with you. If you've liked what you've heard, please make sure to subscribe to anywhere where you access your podcast. We'll see you for the next episode of The Preventable.
Thank you so much, Jenny. This was great.
Thank you.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.